Today we are going to be talking about the flu, influenza, and we're really happy to welcome our special guest today, Dr. Noya Adukwe from Mount Sinai and University Settlement.
I'm Noya Dukwa. I'm internal medicine and pediatrics resident physician affiliated with both the main Sinai Hospital as well as an FQHC in East Harlem called Settlement Health. So, just as a quick introduction, just what is the flu? Like, we hear about the flu, people sometimes even confuse it with the common cold. It's actually something a bit different. So, the common cold can be a myriad of different viruses, but the flu is a specific type of respiratory virus and it's called influenza. And some symptoms that folks can have include fever. Fever is a temperature greater than 104 degrees Fahrenheit. Some people can feel fatigued, have some cough, also have some body aches. These are the most common types of symptoms. Other symptoms that can happen is headache, diarrhea, sore throat, runny nose, or congestion. Very rarely do people have sneezing, shortness of breath, or chest pain. This is diagnosed by a throat or nasal swab, and that's typically after a medical examination that includes listening to your lungs, your heart, also assessing your ears, nose, and throat. How do we treat the flu? Most people think that, okay, if I've got something, I should use antibiotics. That is actually not the case for flu because, as I've said, flu is a virus. Antibiotics are meant to treat bacterial infections. The flu is a virus, and what we typically do for viruses are supportive treatments. Supportive treatments mean staying adequately hydrated. What that means is drinking water, drinking fluids. Some people prefer like Pedialyte, Gatorade. Those can be helpful too. And if you're not in the mood to eat, another way of like staying well balanced in terms of fluids is at least having some soups. Your grandma's chicken soup, your chicken soup. Those are very helpful too. If you are having a fever and or body aches, Tylenol or ibuprofen are helpful. If you are trying to target the fever though, it's better to take Tylenol. If you are trying to target more of the body aches, it's better to take ibuprofen. Some people though cannot take Tylenol for some certain health conditions. Some people also cannot take ibuprofen for certain health conditions. So please speak with your doctor about which is best for you. If you have some congestion, steam showers are fantastic. Those can help just relieve the congestion and mucus. Vapor rub on your chest, on your back is also helpful. And then depending on how soon an individual starts experiencing symptoms, and you go to your doctor or your nurse practitioner or your physician assistant, they might recommend Tamiflu. What is Tamiflu? Tamiflu is an antiviral. Notice how I did not say antibiotic. This is an antiviral that's specifically for the flu. Now, remember how I said there's no specific treatment for the flu. Tamiflu just helps shorten your symptoms. So remember what I mentioned before about the fever, the body aches, the fatigue. It will help shorten the symptoms, not necessarily treat the flu. And unfortunately, Tamiflu is only good for if you have symptoms within 24 to 48 hours. If you've had symptoms for 3 or 4 days, Tamiflu is not very helpful for you. I'm sorry. And so hopefully your influenza doesn't progress. But if it does, what can happen is it may lead to a pneumonia. A pneumonia is an infection of your lungs. And this can be a viral infection, which is what we said that influenza is, a virus. But sometimes, unfortunately, it can progress to a bacterial infection. This is separate. And if your condition does progress to a bacterial infection, then it would require antibiotics. I know that can be a bit confusing, but in summary, flu is a virus. You treat it with supportive treatment, which is hydration, Tylenol, ibuprofen, steam showers, vapor rub, and depending on how long you've had symptoms, might be Tamiflu. If it does progress, then you might need antibiotics, but this is assessed by your provider. And so, how do we even get to not having all of this badness? You can get the vaccine. Also, really encourage frequent hand washing if you or anyone around you has some of the sick symptoms, and masking. You don't have to mask just because of COVID. You can also mask if you have any upper respiratory infectious symptoms. And so, how does the flu spread? I think these pictographs are very, very helpful because once you see it, you automatically know it. But let's just talk about it a little bit more. If you're around someone that has the flu, them talking, as I'm doing right now, can unfortunately spread some of the virus particles if you are in close distance. If you are at a further distance, coughing and or sneezing can project the virus particles into the air, which is kind of what you're seeing with these wavy yellow lines here. And if you're unfortunately on the receiving end, these particles, they don't have friends or foes. They're just going to land anywhere. It can be in your eyes, it can be in your nose. And unfortunately, if you're talking back, it can even go into your mouth as well. So that's the first way. It can be transmitted from person to person. Now, let's say you're all alone and you're not by anyone who's sick, but unfortunately, someone who was sick was in that area. If they did any coughing, sneezing, talking around that area, and there's a surface that those particles can land on, and you come in and touch it, and unfortunately touch your mouth, your nose, your eyes, I'm sorry, folks, but you might get the flu too. And so this is why I was mentioning earlier the frequent hand washing. This is why I was mentioning earlier masking. And then, like I said, we can talk about the vaccine. In terms of how long any one of these like flu particles can stay on a surface, this can be for hours. So even if it's like a 9 to 5 end of the day shift, unfortunately, you are still susceptible if it's on a surface. This brings me to what I was mentioning earlier about how to prevent the vaccines. But a lot of people are like, Doc, my NP, my PA, why do I have to get this new vaccine every year? It should be what I got last year should cover me. Unfortunately, just as we get smarter every day, every month, every year, the flu also gets smarter every day, every month, every year. This pictograph shows that there are 3 different types of major flu. Flu vaccine starts around end of September all the way into like end of March. But the peak time of the flu is December into January. And there are folks who are way smarter than me who are tracking these flu microbes every single year. And so what the flu vaccine is specific to are the virus strains that are most likely to affect us human beings and most likely to do the most damage. Like I said, these CDC experts are way smarter than me. They're tracking these virus strains every year. And as these viruses come into our regular environment, they're able to be like, I'm going to duck, bob, and weave this type of immune response that worked last year. The immune response of the previous year might not work this year because the viruses are getting smarter and smarter. So that's why they need to create a new vaccine every year. And that's why we advise that you take the new vaccine every year so that us too, we are getting smarter against the flu strains. Basically, the more people who get the vaccine, the less likely flu will spread to others because you're protecting yourself and you're protecting those around you. And we need to protect those who are especially at risk. Those who are especially at risk are those who are 5 years and younger, greater than 65 years old, pregnant people, and those with chronic lung and or heart conditions. And the reason why it's so important to protect not just ourselves, but also these folks is that we really don't want these flu strains getting smarter and smarter and smarter to the point that we can't combat them. So this is why we really, really encourage the vaccine, because the vaccine really helps prevent badness and helps prevent them from getting too smart, because we want to be smarter. The flu vaccine, it doesn't give you 100% prevention. I'll be very honest. But the advantage to still getting the vaccine is that if you do get the flu, you're less likely to have really severe disease and much less likely to go to the hospital because of the flu. And like I said, we really want to protect those who are 5, greater than 65, pregnant folks, or those with chronic lung or heart conditions, because those are the folks who, God forbid it, if they have to go to the hospital, they have worse outcomes. So this is why it's just really important to not just vaccinate for yourself, but also vaccinate for the community around you. There are a couple things that folks might not know about the vaccine. It's not only available at your physician's office, it's also available at your local pharmacy. So you don't necessarily have to go to your doctor to get the vaccine, because I understand that some people's schedules might not allow for them to go to their doctor's office. But there's a lot of pharmacies around, maybe by your workplace, maybe on your commute home. So just pop in. They typically have the vaccine ready and available for you. And it's typically available from late September to at least early April. In my pictograph earlier, it showed you that the peak season is around December into February, but you want to get protected sooner than that. And it takes about 2 weeks for your body to build the appropriate immune response to the vaccine. So this is really why we encourage getting vaccinated sooner rather than later. And folks didn't know this. In fact, I didn't know this until I became a doctor, but babies can get the vaccines too. But the earliest that they can get it is at age 6 months. And so really between 0 to 6 months, they're really, really, really vulnerable. And we just got to protect the babies. They're our future, right? The next thing to know for the babies getting vaccine, you don't necessarily have to schedule the flu vaccine separately. When you take your kiddos to go get their regular shots, they can get the flu vaccine at the same time. So please don't feel that you have to schedule it separately for the kiddos. And then, depending on your age, determines how many vaccines you get in the year. For those of us more experienced in life, typically 8 years old and above, we only need one vaccine a year. But for those who are younger, like the 6 years old and below, they typically need 2 vaccines a year. Depending on the availability, it doesn't have to be a shot. It can also be a nasal spray for those who are afraid of needles. Please ask your physician, please ask your nurse practitioner, please ask your physician assistant about the annual flu vaccine, especially when we're in season. Don't just protect yourself, also protect your community, as well as those in the especially vulnerable populations. Please come visit us at Settlement Health Clinic. My clinic is on 106th Street in between 2nd and 3rd Avenue. This is our phone number, the 212-360-2600. That's my card at the bottom right. You can mention me by first or last name. Sometimes I'm not available, but my colleagues are wonderful. You can see some of them in the photo there. And any one of us would be happy to see you, answer any of your health questions.
When you have the flu, what about taking things like NyQuil and Contact? Is a good thing to alleviate symptoms or?
That's an excellent question. So, how NyQuil works is that it's a quote unquote cough suppressant. People are going to be a little bit upset with me, and I understand, but I actually don't believe in cough suppressants regardless of the age. I prefer for my patients to cough up that mucus, because it's really a way to just get rid of the gunk and mucus that's irritating your lungs. And coughing, as annoying as it is a sign that your body's trying to fight off the infection. And I know people are like, but I don't want to be the one to like spread all those virus particles. That's why I encourage masking. People are also saying, well, the cough is really annoying and I need some relief. In that case, I also encourage throat lozenges. So in summary, I'm not saying that NyQuil is the wrong thing to do. No, if that helps you, fine. But I actually encourage my patients to just cough, cough, cough it out. And that's why I was recommending the steam baths, the vapor rub, as well as now lozenges.
Mhm.
Ginger and honey, even lemon tea, do have
Yeah.
medicinal properties. Like that one I can't even like joke with. I do that
Mhm.
myself as well,
Mhm.
especially when I'm feeling poorly. The nice thing about honey is that it's very, very soothing as like a coat for your throat. Ginger does have some like antiviral, antimicrobial properties. And then teas are also like very soothing. Just make sure they're not too hot. Another reason why I encourage teas is that is also a way to keep yourself hydrated.
The concern that people have about getting the flu or flu-like symptoms from the vaccine, what do you say to that?
That comes up with a lot of my
Yeah.
patients as well who are weary or appropriately concerned about getting the vaccine. So, remember how I mentioned earlier that people sometimes confuse the cold for the flu. The cold is caused by other respiratory viruses, but the flu is a specific type of respiratory virus. So sometimes you still might get other respiratory viruses despite getting vaccinated for the flu. And it's very hard to tease out, do I definitely have influenza versus do I definitely have the cold, unless you get a nasal swab, unless you get a throat swab to confirm the diagnosis. But bottom line, the flu vaccine does not give people the flu. And I will repeat that again. The flu vaccine does not give people the flu. You may have another respiratory virus, which the flu vaccine does not cover for. And I'm sorry if that situation does happen. And then remember how I said that it takes about 2 weeks for the body to build the full immune response once you get the vaccine. Unfortunately, let's say you get vaccinated on Monday and you meet Joe Jill on Tuesday or Wednesday, you might still have some flu-like symptoms if Joe or Jill had the flu, but at least your body is building up the immune response such that you are less likely to have severe symptoms, less likely to go to the hospital. And if you are in our higher risk category, again, less likely to have severe symptoms, less likely to go to the hospital. But long story short, the flu vaccine does not cause the flu. You might still get another type of respiratory virus, which you might think is the flu, but cannot be confirmed until you get a flu test. And then, unfortunately, depending on the timing of when you get the flu vaccine, your body might still show some signs and symptoms if it's within that 2 week period.
And the flu vaccine, it used to be live. Sometimes if you get the nasal spray, they don't really do that anymore. So it's not a live vaccine. So whatever symptoms you're feeling is not from the flu vaccine. I have a lot of patients that also say every single time they've gotten the flu vaccine, they always get sick. I think that those are real symptoms that you're feeling. And if that is something you're worried about, what I say with patients too is try to do it maybe on a Friday, get the vaccine so you have a little bit of the weekend, or getting it later in the day or something so you'll be resting a little sooner. So all of that can be helpful.
Like those symptoms are your immune system responding to the vaccine. It's not that you got the flu from the vaccine, because it's not a live vaccine. That's just an immune response, in the same way that you have an immune response sometimes to the COVID shot or other shots.
As your body kind of getting, more prepared to tackle that virus when it encounters it again.
Can other things like sinus infections make you more susceptible to getting something like the flu?
Yes, but at the same time, there can be a chicken or the egg situation, because
Like,
sometimes if your viral flu issue progresses and spreads, it can cause a sinus infection. But then at the same time, if you are susceptible to sinus infections, that really means that the body's natural defense system in your nasal and like airways is already weaker. And so if you do get the flu, it might make it worse. So it depends on what happened first. Is it that you had the flu that unfortunately progressed, or have you had prior sinus infections in the past that have weakened your body's like natural defense in that sinus area, such that if you get the flu, you then have another one? When I started working in healthcare before I became a doctor, I realized that, okay, it's not just about me, it's also about the people that I am surrounded by. And
absolutely.
that really impacted my rationale and reasoning to get vaccinated every year and encourage other people to get vaccinated. It's been very helpful. And I have been one of those who, despite getting the flu vaccine, I get another respiratory virus, but I still faithfully take my flu vaccine every single year, because guess what? I never went to the hospital.
Even if you do get the flu, the flu shot helps to make those symptoms less severe. So always, always, always worth doing every year.
Remember that as September rolls around, that you should talk to your doctor. A lot of people sometimes, if they're only seeing their doctor once a year, if you're only seeing them in like May or June, you won't get the flu vaccine. They won't talk to you about it. So make sure you talk to your doctor about it. And Settlement Health is a great resource. But making sure you have a primary care doctor. And if you just need the flu shot in the fall, then you can also make like a nursing visit. It's a lot quicker to do.